The work isn't finished yet. Clearly, if we look at the immunization coverage data in the different member states in Europe, there is quite a variety, and not all these programs, immunization programs, have been successful up to now. We don't reach a substantial proportion of the children born each year in Europe, and that's really a task still to be done. Well, if we look at the current situation and we really want to eliminate some vaccine-preventable diseases like polio, measles and rubella, as I said, we still have to avoid outbreaks that are currently occurring. And these outbreaks illustrate that there are too many susceptibles walking around in Europe. So the challenge is really to reach all those that have not been vaccinated so far, and that's a very important challenge, how to address these unvaccinated populations, these hard-to-reach populations, how to convince parents that it's a very good attitude, a very good parental attitude to have your children protected against vaccine-preventable diseases. Well, one of these issues is really to better understand the arguments of those parents that are not convinced for immunization or by immunization. We have to listen to them and try to understand what is the real issue, what is how to convince them. That is one of the things we need to do. One of the others is really to invest in training our future doctors and nurses and to devote more time in the medical and paramedical education in Europe for a course on immunization, a course on communication, how important communication is. And finally, I think all countries do have schedules, but not all countries do have programs. So which means childhood immunization should fit in a larger program in the country where enough budget is devoted to prepare a program, to invest in communication, and to have this being part of a more overall activity.